My name is Chris LAI, and my father was an orthopedic surgeon, and so he was definitely my inspiration to become a physician and orthopedic surgeon. I am an orthopedic surgeon, so we take care of bones and joints, and that includes broken bones and joint reconstructions like knee replacements and hip replacements, shoulder replacements. We also do things like carpal tunnel, other sports injuries. So we take care of a spectrum of patients from real young to much older. I think about being an orthopedic surgeon is basically the fact that somebody can come in pain and we can offer them potentially a life-changing procedure. They can be miserable, they can have pain at night, they can not be able to do their daily activities, and with many of our procedures they are able to change their life and they can live a much happier life for many years. Typical day looks like, depends on whether I'm in the OR, in surgery, or in my office. If I'm in my office, we see patients from basically 8 till 4. Patients come in with complaints of pain or issues or injuries, and we make the diagnosis and we do the treatments, and sometimes we decide we need to do surgery. Other patients we're seeing who we've already done surgery on, who are coming in for their post-op visits, and they need to have their wounds checked and make sure they're doing their physical therapy, and we just monitor how they're progressing. If we're in surgery though, then it's doing cases like we said, or hip replacements or knee replacements or ligament reconstructions for the day. It's the relationship itself. So the fact that we are able to see patients throughout their lifetime, basically. If I see someone in their 30s, which I have, and now I've been here 20 years, we see them in their 50s. And so we see people for different problems as they go through different phases of life. And not only that, but we'll see them, we'll see their kids, we'll see their grandparents, and we'll see them at Vaughn's or outside of the hospital as well. And so it's that actual friendship and relationship that's the most important part. Pioneers, it's a small hospital. And so there's the advantage of a small hospital where we know people. We're able to work with the same people over and over. In my opinion, the OR is as good as or better than many of the ORs or surgery centers in San Diego. So I do cases there, and I have to tell the staff here that they're, like I said, as good as or better than a lot of these places in San Diego. So they're very efficient, very professional. All of our patients always have good things to say about the OR and the OR staff and their experience. I think there's a lot of surgeries definitely that we like to see the response, but I think that hip and knee replacements, patients really do come in pretty debilitated and in a lot of pain, discomfort. And sometimes the following day, and even in here in the hospital, they feel a lot better. And so by the time they're recovered, it can be a different life for them.